My name is Dr. Master Simone, and I've been practicing allergy for approximately 45 years. There are two ways to treat chronic recurring allergies. One is with common, everyday, over-the-counter antihistamines, nasal sprays, or a combination of both, and sometimes even a combination of antihistamines and decongestants. The problem with this method, if you have chronic allergies, and I'm talking about nasal congestion, perhaps sinus headaches, recurring sinus problems, postnasal drip, which can cause you to cough. The problem of treating your allergies with medication is that when you stop the medication, your symptoms return. And all you're doing is treating symptoms. You're preventing symptoms by using daily medication. The second, and perhaps the best way, is to determine the cause of your problem through some simple skin test done in an allergist office or by way of a blood test. The skin test is a little more accurate. In this method, you find the source of the problem, you find the cause of the problem, and you treat the cause. How do you treat the cause? Well, if it happens to be pollens, dust mite, mold, or even pet dander, we can make up a vaccine of all the things that you're allergic to. And the conventional, traditional way is to give you allergy shots. So the vaccine is not a medication, and it's directed at the source or the problem. The problem with allergy shots is that for many it's painful. You're getting injections. Initially you're going to get them every week for several months. Eventually they'll be spread out. The interval between injections will be spread out. But the overall time in reality is probably 5 years. Now in my practice, and in over 45 years, we see about a 70% dropout by the end of the first year, because people are not that compliant when it comes to taking injections on a regimented schedule. The alternative to this, and a much better alternative in my opinion, and we've been doing this for more than 4 years, is to use the method that they use in Europe. We take the same vaccine, it's diluted, we put it into a dropper vial. We give this to the patient takes it home and puts 2 drops of this vaccine under their tongue every morning. We've seen some tremendous results with this, and it is so easy for the patient to do. They don't have to come into the office for allergy shots. There are no co-pays. They're not losing time from work or school, so they're much more compliant. They're much more accustomed to using this on a regular basis. The reduction in symptoms, in my opinion and in my practice, has been much faster and much safer than with allergy injections, which could cause some pretty severe reactions. We have never seen a reaction with this dilute mixture. We like to call it natural allergy drops. Why? Because the contents of this is what is in the air, what you're breathing, not only in your home, but what you're breathing outside. So there's pollen, could be a pollen mixture, could be some mold mixture, could be dust mite, could be even your dog or cat. So it's a very natural way of doing this. We haven't seen any problems in hundreds of patients. For more information, please go to our FAQs or our frequently asked questions on our website, naturalallergydrops.com. If you have any questions, just email us, and I'll be more than happy to respond to your email.